Hello, everyone. Nice to meet you. So at this specific thematic webinar dedicated to hydration and moisturizing evaluation. Today, I will present this webinar around all the methods of hydration evaluation. So I will present the hydration in numbers and few information about the biology of hydration. Then Julie from Pixions will give you an overview of how the CCube can help you to evaluate this claim. Then I will come back again and I will give a focus on the choice of the method regarding the classical, but also the more innovative one. So let's start. So in number, what we can say, at Skinobs, we do a barometer every year regarding several claims. And we know, as you see on the right side of the slide, we have a top ranking of the claims searched by the user of the platform, searched by the 9,000 users from 124 countries. And as you see, in 2025, last year, hydration was the first claim. And in 2024 also, hydration was also the first claim. And you see the third claim last year was skin barrier, and before last year it was the fourth. So here it's by territory, and we can see that moisturizing is also almost the same as the same consideration wherever you are. In Europe or US or Asia, it's really the same. You can see that considering a claim regarding hormonal skin, it's not the same. So this is a real, it's the golden claim, and it's really everywhere a top claim. Then, if we look at the testing science routine, we can see that for Europe, biometrological measures are very important. And these Skinobs barometer are the result of many exchanges and lecture of publication, congress like IFSCC or ISBS last month, beginning of this month, or even a business show like in cosmetics. So we see that for what we can consider for hydration evaluation, it can be biometrological, it can be before and after. It's more complex, I think, but science-based proof, it's the concern. Also consumer tests or biomarkers, or also sensory. We will see that, and also connected diagnostic. We can see three signals from the Skinobs data. We observe an increasing demand for deeper analysis of the hydration, like not only the stratum corneum, but also the epidermis and the dermis, with this question of multi-layer. And we can see that with the electric component of the skin, but also with imaging or with microscopy confocal microscopy. We see also an increase of the request regarding hydration and the structure, because we know that hydration balance of the skin, it's not only at the surface, it's also linked to the epidermis, with the renewal of the epidermis, and the filaggrin, and also the network of the dermis. The collagen, it's not directly linked to water, but the network is very important. So we saw that in the request of new technology like interstitial fluid sample to analyze biomarkers. And then the third pillar, it's a global ecosystem, but concentrate. And this is the figures we have in the platform. What we gather since 10 years, it's all the methods, and I will give you a look. And for this hydration claim, we can find 178 clinical solutions with 66 study parameters and 208 providers. So it's a large and comprehensive solutions that are offered by testing suppliers. What we saw at Cosmetotest this year, it's the preclinical and clinical symposium dedicated to the evaluation of dermocosmetics in Lyon. There was a session regarding hydration and moisturizing. We lead this roundtable with specialists, but before we wanted to ask our community how they consider hydration, and that was very interesting because the corneometer, as you see in the middle, was the most the favorite instrument, but the moisture map also, which give an evaluation by a level of gray, and the transepidermal water loss, which is not directly a measure of the hydration, but a measure of the water evaporation. And then you can see that Raman spectroscopy arrived also here. In this landscape, what are the priority in the hydration testing? People were looking for standardized laboratory, like standardized condition. And also, you see 10% with real world. And we will see that later, that the real world evaluation opportunities is more and more important regarding the data we can collect from the consumer, regarding all the diagnostic tools that are available. And then people are looking for hybrid approach. And since 2026, I will say that we can really speak about multimodal protocols, in vivo multimodal protocols. Because before it was, we talk about multiparametric but now it's really, and we see that this hybrid approach, it's 30%, it represents 30%. And the most challenging claims you see on the right, the answers were about long-lasting efficacy, how to substantiate like 72 hours hydration or deep hydration, or what are the claims linked directly to moisturizing, and we will see there are many, and how to evaluate rinse-off performance. Some questions were related to what are the next technological innovations. We will see that also, and what can be the common methodological mistakes. At the moment, what the market is actually measuring, it's really just a summary before the presentation of Julie. We can see that we have several categories, and you can find all these categories in a big table we published yesterday with the Focus 14 dedicated to hydration measurement. And it's really a big table, and so we just extract some main information. And for skin and dermis hydration, there are solutions like Moisture AP, Moisture D, or the Epsilons, or the new Nevisense, or the Dermo, or the near infrared. And for stratum corneum hydration, you have many solutions like the corneometer, Moisturometer, and also atomic force or X-fluo. We will see that later. For more structural evaluation with collagen and elastin, we can use ultrasound, we can use confocal microscopy, or RSOM Explorer. And Another solution is the microtopography of the surface that are provided by Epsilon and Moisture Map. So the biology of skin hydration from surface to dermis, we can see that first the stratum corneum. You see here I put the pH because the pH is important in the mechanism of the epidermis renewal with the filagrine and it's not a direct impact, this epidermis renewal, but it has an impact. Also now we see microbiota evaluation. Margot Moujean from Biome Labs at Cosmetotest gave a presentation related to microbiota and hydration. So it's interesting to consider this. Of course, the transepidermal water loss, the impact also on the radiance on gloss, and then we can say, okay, we can measure, evaluate the full face if we like. Sebum and lipids have also their importance. We can see sebum, we can analyze, we can see lipids like ceramides and between the corneocyte in the stratum corneum by strippings, or we can also analyze the lipids from suction system or interstitial fluid. That's possible. And also the repulping gives the impression of a high hydrated skin. For the viable epidermis, the mechanism important is water transport and renewal, and these are the several measurements. And for the dermis, it's more structural hydration, as I already said. Just as a reminder, after this webinar, you will receive the link for the replay, and we will send you this presentation upon request. Just send us an email, and we can send you the presentation. There are many imaging dimensions, but three of them are the most important, I think. So, as I said, the microbiome, also postmenopausal skin, because hydration decreases a lot during the peri or pre or postmenopausal period, and it's very interesting to consider this type of skin, and also the exposome, whatever it is, pollution or UV or everything, temperature has an impact on the skin barrier, has an impact on the hydration. So now I will stop to share my presentation, and I will give the floor to Julie.
Thank you, Anne. Okay. Can you see my screen? That's okay?
Yes, we can hear you very well, and maybe you can just change your slide to be sure.
Up.
Yeah, perfect. Thank you very much.
Perfect. Thank you. So good evening, everyone. I am Julie Przybylski from the company Pixiance, and today my goal is to introduce you how imaging system can enrich the assessment of skin hydration during cosmetic studies. As Anne said, hydration is one of the most used cosmetic claim, but it is also one of the most complex to demonstrate in a complete way. So we will see and try to explain how the imaging system can provide relevant and complementary dimension to traditional measurements. To briefly remind you who we are, Pixiance is a French company. We are specialized in clinical imaging calibrated system for dermocosmetic research. We are developing the C-Cube CR providing standardized 2D and 3D imaging for skin and hair with a simple goal: transform skin and hair phenomena into quantitative, reproducible, and usable data for the studies. When we are evaluating a moisturizing product, traditionally corneometry or transepidermal water loss are essential because these methods provide quantitative data on the water content of the skin, but requirements of clinical study have evolved very fast, and today demonstrating biological effect is not enough. It's also necessary to illustrate and objectify the benefits provided by a product or active ingredient, because the consumer not perceive corneometry value. He will observe smoother skin, less flakes, change in fine line, or more radiance. This is why biophysical methods have to be complemented by imaging technology, which are able to provide information on skin surface, texture, color, etc. And this is precisely the link between biological measurements and benefits that is a major issue in efficacy studies. Let's move on concrete example. When an active or product improves the skin hydration, several manifestations can be observed. We can see decreasement of the scales, an improvement of microrelief, a smoother or less rough skin, reduction in fine line caused by dehydration, or improvement of radiance of the complexion. So the interest of imaging is precisely to quantify this phenomena in a simultaneous way. So I will detail the relevant studies on these subjects. First, flaking is one of the most visible signs of dry skin. On this parameter, it is interesting to work with in ex vivo studies using a patch, like for example, desquam or corneofix, and then collect the scales and quantify automatically and in the standardized way. We will then be able to obtain an index and also a classification in 5 categories according to the thickness of the scales. And in practice, the decrease of this index over time is one of the first signs of an improved hydration. Second relevant example of a study is the roughness of skin. Indeed, hydration has a direct influence on the appearance of skin surface. So better hydrated skin generally has a more homogeneous texture, less relief and less roughness. So we will be able to quantify these changes thanks to a 3D reconstruction and via some parameters that are associated with the ISO 25178 standard, which are the SA, SQ, and SDR parameter. So in contrast to simple visual or feeling assessment, these measurements are objective and also independent of the operator. And after hydration, we can see on this before-after example that SA, SQ, and SDR parameters have to decrease. Then we can also look at the study of skin radiance, because the way light interacts with the skin surface can change depending on the level of hydration of skin. When the skin is more hydrated, light reflection tends to be more even, which contributes to a perception of radiance. We will thus follow the evolution of the L parameter in the image, which is associated with the luminosity of the skin. And in the case of radiance, imaging brings a complementary visual dimension because this assessment is often carried out using dedicated probe only, like the glossimeter, but it is not illustrated. Finally, the last example is studying the microrelief. So the microrelief corresponds to all microstructure present on the surface of the skin. It evolves with age, hydration, environmental exposure, etc. So high resolution tool can observe and quantify the organization of skin furrows networks. A dry or dehydrated skin will have more pronounced furrows and oriented in a preferred direction. This is anisotropy. And a properly hydrated skin has furrows going in all directions, reflecting better isotropy of microrelief, like the example on the right. So these 4 examples illustrate the idea that hydration is not a single parameter. It results in a series of visible and perceived changes that can be objectified by imaging. And this analysis requires high precision imaging system able of observing the skin at the microdermoscopic level. And this is where talking about our tool, the C-Cube Clinical Research, can be interesting because our system was developed with a very specific logic to make the link between the instrumental rigor of probe system and the visual capacity of the imaging system. It is also ultra resoluted and has this quite unique microdermoscopic field. This field allows to target specific areas and observe microevolutions on these areas, invisible to the naked eye and even on a macroscopic scale. To obtain this kind of data, the system relies on 3 key technological points. First, the color calibration with correlation to the chromometric references that ensure reproducibility of color. Then a combination of homogeneous lighting and optic, which will eliminate the shadows on the image and the distortion. And the third technological point is the true 3D reconstruction, which is based on the stereophotometry technology, allowing the extraction of surface parameter, for example. So these 3 elements are essential to ensure that the differences observed during the study are due to the product being tested and not the condition of acquisition. To conclude this quick presentation, hydration is not just a matter of water content measured in the skin. It also results in a series of modifications that greatly contribute to the effectiveness of the active. So ultra high definition the microdermoscopic system will thus allow to objectify these changes, quantify them, but also illustrate them. And by combining it with the traditional biophysical method, it contributes to build a more complete, reliable, and multifactorial demonstration of the efficiency of the moisturizing active or product. Image does not directly measure dehydration, but it allows to objectify all its consequences on the skin. So the capacity of C-Cube have been validated by the literature. You have some example of publication here. And the C-Cube is also used in laboratories and CRO in France, Europe, and all around the world. Thank you everyone for your attention. I remain available for all your questions, etc.
Thank you very much, Julie. Yes, after this, the last party of my presentation, we will have a Q&A sessions. You have a little tool so you can ask your question. Don't hesitate. We will be thrilled to answer you. So now I will go on. Yes, I have to share my screen. Yes. Is it okay? I hope that you see my screen. So now we will go on the measurement method and several ways there is so many solutions. So here we will see some methods, like if you like to see the immediate surface hydration, you can use corneometry, but you can also use, as Julie explained, you can use surface imaging. You can use transepidermal water loss to study the barrier repair and water evaporation. You can also use several other methods to study the deeper hydration, like hauteur or near or multimeter PD. And you can also look at the dermal structural hydration by ultrasound, by confocal microscopy, or by Raman. And then you can study the whole skin using LCOCT, more linked to density and quality. So that is the big table I was talking about. In this, in the last focus 14, we published yesterday. We wanted to gather all the method, and you see here, I will not go through all the method because it will take more than the afternoon. So here you can find information about hydration, all the dielectric component method and the spatial distribution, the hydration gradient, and optical by infrared, and the composition of the skin with biomarkers, with collagen content, with molecular content, and distribution in the skin. And also, if we can look at the sensory and perception. We will see that more in details, like the softness. And if we look at the surface, we can have a lot of information. We can have the nano topography of corneocyte, the surface visualization of the micro-relief network, and also the surface characterization, and also everything about structural. But you can find that in the Focus 14. If you are not a subscriber to our newsletter, you can do it. I will show you later. And then you can find this table. So here it's a dielectric component presentation with the corneometer, the dermalab, the moisture map, which give also imaging, and the optical spectrum method with the near spectroscopy, the confocal Raman, or the hauteur. The indirect method with skin barrier, and I just want to say that for transepidermal water loss, there is two big direction, no direction, but more approaches. The open chamber provided by Courage Kazaka and Cortex with the TEWL meter and dermalab, and the closed chamber with the epsilon, the vapometer, and aquafluid. When we look at the biomechanical and histological method, we can study the molecular composition using the Raman spectroscopy. We can see the cellular composition with the confocal microscopy and the LCOCT. We can also, by stripping or by several skin samples, study the NMF by HPLC or the lipid profiling. after this presentation, I will go directly in the platform to show you how it looks for the preclinical, because I did not have time to focus on both in vivo and in vitro, but we will understand how it's easy on the preclinical category of tests to find all the endpoints. Here it's information about skin surface analysis, what Julie explained you. And here, some people ask me, will you speak about hair care, hair care and hydration in this presentation? And I think hair care is really a dedicated presentation, because on hydration, it's not a real for scientists and for scientists. They will not consider hydration as a good claim for hair, maybe for scalp, but not for hair. To study the structure of their hair, there are so many possibility, like the new minister from EOTech, you can study electron microscopy, you can do X-flow, you can do a lot of skin thing, even Raman microscopy on the scalp. So now I have the pleasure to present you what I consider as emerging method for hydration claim validation. So we can see LCOCT, and during the ISBS Congress in Lyon 3 weeks ago, it was really the star. The LCOCT was the star with the at the beginning, we can consider the LCOCT as an imaging method, but now with all the AI and algorithm, it's a really quantitative method. And what we can see, it's in the evolution of this emerging method is a cross-link, a crossover of imaging, like LCOCT. At the beginning, it's more imaging, and they go to the quantitative. And even the scientist from Riverde, from Raman microscopy, which is really quantitative, gave a presentation regarding imaging, how they use a new algorithm to offer image beyond the figures. So this is the very important point. And then another point is the connected sensors and wearable. At the same ISBS Congress, we have the great chance to have a presentation from Alex and Kene from Clarence with using a Z pen for it's a home device, a new hydration tool developed with a special laboratory from Lyon. And then you have also the Cliniscale from Courage et Kazaka. And I just want to remember that with Jean-Jacques Servant, founder of EOTech, and with Pascal Barrier, 2 years ago, we decided to give a panorama of all the home devices as diagnostic. And finally, among 80, we selected 23 of them, and we wanted to discuss and challenge them. So if you like, I can send you these. We present a poster at the IFFCC, and we have a 10 pages article. If you like, you can send me an email, and I can send it to you. And then, as new emerging method, we can see the Tucci finger developed by the LTDS, École Centrale, and it gives an information about the tribology of the skin and also the hydration. These two methods are quite new, and it's saying that also the surface is important, but the surface with focus on the corneocyte. Loretta Biotech from France, they are really new, and they offer by stripping, measure with atomic force microscopy with specific index, and also CAMAX from France also, they use the X-fluo and they analyze the corneocyte surface and volume. So that's very interesting because it's quantification and also visualization. Also, the new method presented by SGS IEC group at it was in cosmetics with Oriba, with this new e-robot Aqualog Next, with a new skin probe for Raman spectroscopy. And at Cosmetotest, there were 35 exhibitors, and one of them was Asquilion. Asquilion, it's very interesting. It's like it's a medical device. It enables to collect the interstitial fluid of the skin. You just put it on your on the skin surface for 2 minutes, 2-3 minutes, and then with very small needles, you collect this fluid, and only after 5 minutes there is no wound on the skin. So it's very interesting. And after we have the C-base, which offer a new way to see the electric component of the hydration of the skin. Also connected mirror and all the apps. But what I can say regarding the apps, the diagnostic app, there is really two worlds. The world of marketing, which enables to get data from the consumer and data for recommendation of products, and then the app that are really dedicated for R&D and really providing raw data and robust information. And so that's a big challenge. So next one, we will see what can be the main information, the main element to be focused on when designing a protocol, in vivo protocol, is the recruitment, the data acquisition, and the data treatment, data acquisition with the standard condition and the choice of the parameter, and the data treatment with AI, but also raw data and interpretation. This is some numbers about the hydration on the Skinobs platform, but you can see that later because I see the time is going fast. It's flying. So here it's just a summary. You can see that for hydration, we have many solutions on the platform for clinical studies and surface of the skin. This is the number of methods, number of testing providers and countries. And I just remind you that there is no commission between the CROs and Skinobs. It's just a platform to connect people. So, as conclusion, I will say that the future evaluation is really multimodal, as I said, cross-imaging and quantification, and we can consider the 4 questions: what support I am using, in which conditions, what biomarkers, and what analysis. Is it multiomics? What biomarkers, like is it just the relief? Or not only just the relief, but the relief, is it the filagreen? Is it the VOC, like for a volatile organic compound? And there was a very interesting conference from a scientist at the ISBS developing the interest of VOC for the evaluation of the skin. Now I will just show you the platform for the preclinical. So I think it's very interesting for you to get this information. So I will start again my screen. So here, everyone can be have full access of the platform, whether you are a project project development, evaluation manager, or sign-in from the dermocosmetic area. And here, so I will put it in English. So you see, you have two categories. The one is the preclinical for in vitro ex vivo here, and in silico and regulation, and one for the clinical. So if we look at the clinical, just briefly, you can see that if you look for efficacy, we can do also consumer testing for hydration or sensory analysis, but if we focus on biometrology, if you select here facial care, and here claims moisturizing, you get a very big list. You can be afraid, but please don't be afraid. And just it's how you can study the hydration. You can study the desquamation, as I said, the renewal. You can see the full face. But here, for example, you see direct hydration measurement, and you find all the method I spoke about, like the corneometer. You have the details. If you want to save this method because you are very interested in this, you can save it. You have it in your project. If you want to say, you say, okay, I want to test this method with these providers, so you can send your message and then get your message directly. And if you say, okay, yes, but now I want, we talk about Camax, okay? You just have to select device manufacturers and say, okay, Camax, and you can see the solution by Camax. Or if it is the same for Loretta, okay, you don't remember exactly what they do, and you have here a very interesting information, and you can see and send them directly a question. So that's how it works for the clinical. And for the preclinical, I just want to share with you this efficacy among safety, penetration, everything. If you select moisturizing, it's the same. It's the same way it works. You can select moisturizing and say, okay, how I want to study moisturizing. It's linked to barrier function, or I say, okay, it's really hydration. You can select your methodology, but you can also directly see all the endpoints. And that's very interesting. You can see, for example, why selecting in involucrine, and you have the details why studying involucrine. And you can do that in both ways. So imagine you don't select moisturizing, you don't select hydration, and here you say, okay, filagreen, I have heard about that. And you just ask for filagreen, and you can say, okay, filagreen is involved in this several mechanisms of actions. We work to gather all this method. We work with 3 consultants in biology. So it's very interesting for your knowledge. And you can also select the country, you can select the type of supports as we do generally for all the tests. After that, I will present you. So this is the focus you find in the cosmetic testing news. If you want to know more about hydration, you can always ask the cosmetic testing news, because we gather more than 5,500 articles about this. So you have for hydration a lot of answers. And then here you can see the zoom and the focus and everything. So now it will time for the Q&A. I hope I was not too long. So I think we have two questions. One is, in a corneometry study, in your opinion, after how many hours can we support the claim all day long or all day hydration? Yes, thank you for your question. All day long, it can be, you can do after one application of products, standardized application, and you can measure, for example, after 8 hours. That can be considered for a day. But I will just be careful, because the method and what you can say is really linked to the regulation in your country. So sometimes you can say something in Europe, but you can't in US or in China. So I think it's very important to validate the method and the protocol with your regulatory consultant. And after, you can also do after a day. For example, you can the volunteers can come back after 24 hours, for example, after the first application. But after, subject, it's human, and if you ask them not to wash their face, not to add other products, it can be difficult. So I will recommend for one application with corneometry to keep the subject in your laboratory, in the laboratory. And then another question about the cutometer. Thank you, Flavia, from Medicine, I think, in Brazil. Thank you for being there with us. What's our opinion about cutometer parameter to measure plumping effect by dermis hydration? Yes, it's true that hydration can be linked to the viscoelastic properties of the skin, and you can combine the electric component or imaging or surface analysis like with the C-Cube with the cutometer. That's really a good idea if you want to know better how your products works and how the performance can be scientific validated. We don't have other questions. I will thank you, all of you, for being there. We were more than 200 subscribers to this webinar. We will have other thematic webinar like that. We decided to launch this type of webinar. The hydration is the first one, and end of August we will have the skin barrier with presentation of a company. Yes, Lipotype. It's a German company dedicated to the analysis of the lipids. And then every 2 months we will have this webinar. You can have a look to the YouTube channel, to the cosmetic testing news, and you will receive all information after this webinar. Thank you very much, Julie, for being there with us.
Thank you, Anne.
And I wish you all a nice summer, not too hot, hopefully. And see you soon. Bye-bye.
Goodbye, everyone.